Hello! We are now moving on to the shoulder. We're going to do a short anatomy review. So the shoulder complex, made up of your clavicle, humerus, scapula, and even your rib cage. So just to kind of define that a little better, your shoulder is considered your glenohumeral joint, which is the articulation between the scapula, particularly the glenoid fossa of the scapula, and the humerus. The shoulder girdle is the glenohumeral joint plus the clavicle, so scapula, humerus, and clavicle. Then the shoulder complex brings in just a little bit more. You've got your glenohumeral joint, your acromioclavicular joint, your sternoclavicular joint, and your scapulothoracic joint, which is considered a functional articulation because of that the scapular rotation on the thoracic cage. The AC joint and the SC joint, we'll talk a little bit more in class about the rotation and arthrokinematics that occur there during glenohumeral motion. Just a quick review, your rotator cuff muscles. You have your supraspinatus, your subscapularis, your infraspinatus, and your teres minor. Okay, both anterior and posterior view there. So prime movers of glenohumeral flexion are the anterior deltoid and the pectoralis major. So the anterior deltoid originates on the lateral third of the clavicle. It inserts on the deltoid tuberosity. The anterior deltoid does shoulder or glenohumeral abduction, flexion, internal rotation, horizontal adduction, innervated by the axillary nerve. The pectoralis major, it's the clavicular portion that performs glenohumeral flexion. It originates on the medial third of the clavicle, inserts on the lateral lip of the bicipital groove. Its action is the first 60 degrees of shoulder flexion, and it's innervated by medial and lateral pectoral nerves, C5 through T1. So in glenohumeral extension, you've got your posterior deltoid that originates on the spine of the scapula, inserts on the deltoid tuberosity. It performs shoulder abduction, extension, external rotation, and horizontal abduction. Is innervated by the axillary nerve. The latissimus dorsi originates on the spinous processes of T7 through L5 via the thoracolumbar fascia, posterior sacrum, iliac crest, and the lower three ribs. The latissimus inserts on the medial floor of the bicipital groove. It performs shoulder extension, adduction, and internal rotation, and is innervated by the thoracodorsal nerve. And continuation of shoulder or glenohumeral extension is a teres major, originates on the inferior axillary border of the scapula near an inferior angle. It inserts on the medial lip of the bicipital groove. Its action is shoulder extension, adduction, internal rotation, and is innervated by the lower subscapular nerve. Pectoralis major, the sternal portion of this pectoralis major, it originates on the sternum and the costal cartilage of the first 6 ribs. It inserts on the lip of the bicipital groove. Its action is the first 60 degrees of shoulder extension. Now, the first 60 degrees goes from 180, so a vertical humerus basically, to 120. And it's innervated by the medial and lateral pectoral nerves. And here are just some pictures of your deltoid. I couldn't get singular ones, but here you see your middle deltoid, your anterior deltoid, and then the posterior deltoid. You know that's posterior because you can see the scapula there. Here is your pectoralis major. Here's your sternal portion. Here's your clavicular portion. Just note here that the clavicular portion is superior to the sternal portion, but its insertion is inferior. Ta-da! And then here we have the latissimus dorsi, and you can see that it actually inserts on the anterior humerus. That's why it's got that kind of green color and the dotted line. And here is your teres major. Whoops. And it also inserts anteriorly. That's why it performs internal rotation. Okay, glenohumeral abduction. Prime movers are, and it's all the deltoids really that work together to do shoulder abduction. I just wrote the middle here because the other deltoids, anterior and posterior, are noted on previous slides. So it originates on the acromion process, inserts on the deltoid tuberosity, as do the anterior and posterior deltoid as well. It performs shoulder abduction and is innervated by the axillary nerve. The supraspinatus originates in the supraspinous fossa here of the scapula, inserts on the greater tubercle of the humerus. It performs shoulder abduction and is innervated by the suprascapular nerve. Adductors, or prime movers of adductors, are your pectoralis major, the middle third of the clavicle, sternum, costal cartilage of the first 6 ribs is its origin. It inserts on the lateral lip of the bicipital groove. The action is shoulder adduction, internal rotation, horizontal adduction, is innervated by medial and lateral pectoral nerves. The teres major, inferior axillary border of the scapula, near the inferior angle, inserts on the medial lip of the bicipital groove. It performs shoulder extension, adduction, and internal rotation, and is innervated by the lower subscapular nerve. The latissimus dorsi originates on the spinous processes. We did this one already. Yeah, I'm not going to say that again. Moving on. External rotation is your infraspinatus, your teres minor, and your posterior deltoid. And here are these pictures. This is your infraspinatus, and teres minor just shows them in relation to each other. The infraspinatus originates on the infraspinous fossa of the scapula. Greater tubercle of the humerus is where it inserts. The action is external rotation, horizontal abduction, innervated by the suprascapular nerve. The teres minor, tucked right below it here, originates on the axillary border of the scapula, inserts also on the greater tubercle of the humerus, and also performs external rotation and horizontal abduction. It is, however, innervated by the axillary nerve. And the posterior deltoid originates on the spine of the scapula, inserts on the deltoid tuberosity. It performs shoulder abduction, extension, external rotation, and horizontal abduction, and is innervated by the axillary nerve. Internal rotation, performed by several muscles already mentioned, such as the latissimus, teres major, pectoralis major, anterior deltoid, and here you'll see your subscapularis, which originates on the subscapular fossa of the scapula, so that's that anterior surface of the scapula, inserts on the lesser tubercle of the humerus. It performs shoulder internal rotation and is innervated by the upper and lower subscapular nerves. Horizontal abduction is performed by the infraspinatus and teres minor, also mentioned earlier. The horizontal adduction is performed by the pectoralis major, also mentioned earlier. Another little picture here, same picture, but of your sternal portion and clavicular portion of the pectoralis major. Quick rotator cuff muscle review, just the rotator cuff and their action. So the supraspinatus performs abduction, the infraspinatus performs external rotation, horizontal abduction, teres minor performs external rotation, horizontal abduction, and subscapularis performs internal rotation. In the scapulothoracic articulation, the scapula can elevate through the upper traps, levator scapula, and the rhomboids, and it depresses through the lower traps, latissimus dorsi, and the pectoralis minor. Protraction and retraction also occurs in that scapulothoracic articulation. Protraction is performed by the serratus anterior, retraction by the middle traps, lower traps, and rhomboids. The end. Thank you for listening.